last time we talked, Dr. Nassif, it was all about baby Paulina and her big birthday party. What have been Paulina's biggest milestones since then?
Well, I think if I'm not mistaken, I think it was posted on my Instagram recently, her walking.
Exciting.
And now, she's not walking. She's standing up, taking a few steps. And, now she's 15 months. That happened before 15, I think right on her 15-month birthday, if I'm not mistaken. And that to me was, most incredible milestone, and she is such a happy, sweet, wonderful baby. And now the few words are coming out, but that's going to be the next thing, is running around and more vocabulary.
Now with a 15-month-old, is the balance between work and being a dad, is it more of a challenge these days?
It's hard because, I work hard, and, between my surgical practice, Botched, running a surgery center, running a skincare company, Nassif MD Dermaceuticals, you have to put in that time. So what I try to do is get into office very early and get home at a decent hour and try to really be home during the weekend. That is my goal.
Now, raising a girl is so different than raising boys. And as one of the most revered plastic surgeons in the world, how do you plan on talking to Paulina in the future, way, way, way down the line, about plastic surgery? Like, if she ever wants to get anything done, would you encourage her to go for it, or would you warn her against it?
Just like any other dad or mom would say, depending on what it is.
Yeah.
For example, listen, if you got floppy ears and you're being teased all the time, or you have a breathing problem or a big gigantic hump, and, it's really hurting your self-esteem, or there's a functional issue. And unfortunately, you kind of have to weigh in really what is the best thing for your child. Then that's one thing. But obviously, listen, if they want some, balloon up their lips or to go do something weird and crazy, of course, just like any parent, I'm going to try and discourage it.
Just when you think you've seen it all on Botched, a new season premieres, and it comes with a whole new shocking set of plastic surgery cases.
The man, the myth.
My name was Rodrigo Alves.
Rodrigo!
I'm a pricey bitch, and I don't care if you don't like me, bitch.
I think I'm kind of a cheap bitch.
Every year we have hard cases, and every year those cases get harder, and we keep saying this is the hardest, time of all. Actually, what's different about these 6 episodes is that they're very odd and weird, and some of the findings that we see are shocking, besides to you, the viewer, but to actually us. Things that we didn't expect to see before. So some of the deformities and the traumas and the findings are bizarre. That's number one. So we're shocked. 2, some of the stories are unusual.
I ended up losing my entire upper lip. My identity was taken from me.
It was so incredible to see on the premiere episode the work that did Aisha to reconstruct her lips. Were you even surprised at how well the surgery came out? It was amazing.
I thought I could help her a decent amount, but not as good as she came out. So that's like an absolute win. And, redoing the flap and the lip lift and removing some tissue from the upper lip and making her commissure better, and that's a transformation where, it's not like you get those every day.
My favorite part of watching Botched is seeing the patient look in the mirror for the first time and see all the beautiful work that you and Dr. Dubrow have done. How does it feel for you when you watch that patient take a look in the mirror for the first time? Is it emotional?
I have patients do that a lot, and God willing, so there's three things that happen. Usually someone looks at it and say, it's swollen, and they're not happy. And then you got to work through that. 2, they're very happy. 3, when you have that rare emotional event, and it's been on Botched before, where a patient sobs or tears up, gets very emotional. a cathartic release. Yeah, it's emotional. I think throughout the years, I've had to kind of go like this, and I've had to wipe. I started crying.
Yeah.
So it's still emotional.
These patients put so much trust in you and Dr. DeBro. I think Paisha even said, like, you were the only man who she felt comfortable going to, reconstruct her lips. Does that trust that the patients put in you, does it make you more confident in your work, or does it add more pressure?
Both. Because if the patient has a complication, doesn't heal well, and they put all their trust in you, you feel like you let them down. At the same point, makes you feel good, great, but listen, this is not about ego anymore. And, we've been there, done that. I mean, the goal is, it's very hard, complicated surgery. And so DeBro and I, if you notice, we don't really have egos like, we kind of, we'll be happy to say, hey, you know what, you healed really well, and I'm so happy for you. And so, it's one of those things where it's cautious. We're cautiously happy when we hear that.